Friends, myself Siddharth Chauhan. Welcome to Easy Medicam. Today's part of the video will be covering about the remaining section of the facial nerve. In the previous section of the facial nerve, we had covered about that the facial nerve is a mixed type of nerve, and the five major branches of the facial nerve are the temporal, zygomatic, buccal, mandibular, and cervical. And the three principal branches of the facial nerve are the greater petrosal nerve, which supplies to the lacrimal nerve to the stapedius, which supplies to the stapedius muscle, and the chorda tympani nerve, which supplies to the mandibular gland, sublingual gland, and the tongue. So in this part of the video we will covering about the remaining section of the facial nerve. So let's start this. In general, the facial nerve is having three types of fibers: somatic motor fibers, parasympathetic fibers, and the sensory fibers. We had covered about these type of fibers in the previous section of the facial nerve. So in general, the somatic motor fibers will convey the somatic motor information or somatic motor impulse from the skeleton to the skeletal muscles of the face, which are the muscles of the facial expression, except for the chewing muscles, which being supplied by the trigeminal nerve, which is the fifth cranial nerve. And the parasympathetic fibers of the facial nerve is supplied to the lacrimal gland, nasal, palatine, submandibular gland, and the sublingual gland. Whereas the sensory fibers of the facial nerve is supplied to the anterior 2/3 part of the tongue and the general sensation impulse from the tiny patches of skin on the ears also. So in general, these type of fibers are having their respective nuclei also. The motor nuclei lies deep in the reticular formation of lower parts of the pons. In the lower part of the we know that the reticular formation is present in the full part of the brainstem. So in the lower part of the pons, where the reticular formation is present, the somatic motor fibers of the facial nerve are having their nuclei there. So the somatic motor fibers nuclei are present deep in the reticular formation of lower part of the pons and supplies to the muscles of the facial expression. So these type of fibers will supply to the muscles of the facial expression, and the auricular muscles, they will supply to the stapedius muscle, they will supply to the digastric muscle. It is a posterior belly of the digastric muscle which is being supplied by the somatic motor fibers of the facial nerve. So this is the posterior belly of the digastric muscle and the stylomastoid muscle. So I'll write here, this is the posterior belly of the digastric muscle. It is not an anterior belly of the digastric muscle. It is a posterior belly of the digastric muscle and the stylomastoid muscle. So these motor nuclei are present in the reticular formation of lower parts of the pons and supplies to the muscles of the facial expression. It will supply to the auricular muscles, it will supply to the stapedius muscle, it will supply to the posterior belly of the digastric muscle and the stylomastoid muscles. Whereas the parasympathetic nuclei lies posterior-laterally to the main motor nuclei. The main motor nuclei are present in the reticular formation of the lower part of the pons. Just posterior lateral to these nuclei, which are the somatic motor nuclei, just posterior lateral to this type of nuclei, the parasympathetic nuclei are present. So we have to remember this: their parasympathetic nuclei are posterior lateral to the somatic motor nuclei, isn't it? And while traversing the temporal bone, within the facial canal, the facial nerve will give rise to the three principal branches, which are the greater petrosal nerve, which will supply to the lacrimal part, nerve to the stapedius, which will supply to the stapedius muscle, and the chorda tympani branch, which is a important one, and this will supply to the submandibular and sublingual gland. If somehow the facial nerve will get paralysis, if facial nerve will get paralysis, it will cause a condition which is called the Bell's palsy. The Bell's palsy is a condition, or it is characterized by the paralysis of the facial muscle. If somehow the facial muscle will the nerve which supplies to the facial muscle will get paralyzed, it is called a Bell's palsy. In this condition, the affected side and the partial loss of the taste sensation may develop rapidly or often overnight. It is caused by a herpes simplex infection. So it is important that it is caused by the herpes simplex infection. It is a viral type of infection which will produce an inflammation and swelling of the facial nerve. If the facial nerve, due to this viral infection, the swelling or inflammation will occur on the facial nerve. The lower eyelid droops, the corner of the mouth sags, and the eye constantly drips tear and cannot be completely closed. The condition may be disappear spontaneously without treatment. So there is no treatment for this palsy. It will automatically will get disappear, or spontaneously it will get disappear without any treatment. So this type of condition will occur due to the viral infection, which is due to the herpes simplex viral infection, which will produce inflammation and swelling on the facial nerve. So that's all for this part of the video. We'll be covering about the next cranial nerve in the next part of the video. So friends, do like, share and subscribe my channel and press bell icon for more notification, and please guys do comments also. Thank you. Please like, share and subscribe Easy Medicam and press bell icon for more notification.